As we get older, the likelihood of suffering a fall increases. Many of our older patients are afraid of falling. So let's talk a little bit about some simple things that you can do or help your loved one do to prevent falls. The first thing is to stay active. Bones, muscle, and the ligaments in the body require activity and exercise to stay healthy. And if the bones, muscles, and ligaments stay healthy, then there is a decreased risk of falling, and also there's a decreased risk of injury with a fall. Another thing is check your hearing and your eyesight regularly. A decrease in hearing and balance function, which sometimes is from the ear, and also a decrease in vision can lead to somebody having a fall. Look at your medications. Medications can cause side effects such as dizziness and lightheadedness, and sometimes medications can be the cause of a fall. So take a look at your medications and see if there's any medications that are putting you at risk of falling. Get enough sleep. I think all of us would love to say that we got enough sleep, but you are more likely to have a fall when you're tired. So take that into consideration. Limit alcohol. Alcohol consumption can obviously increase the risk of falls, and we've had several patients that have fallen as a result of impairment due to alcohol. One thing to remember is to stand slowly. As we get older, the blood pressure and the blood flow to the brain doesn't accommodate as quickly. And so take a minute to get up out of the chair and to stand and make sure that you have your balance as you get up and go walking. You may consider using an assistive device when you're walking, such as a walker or even a cane. And I don't think that any patient should feel like there's something wrong with them because they have an assistive device. It may be the right thing for you to prevent what can be a significant injury. Obviously, be very careful on icy and wet surfaces. One of the most common reasons patients come to the emergency room from trauma during the winter time in Utah is because of falls on the ice. And finally, make sure that you have good footwear that has a good traction sole on it. Avoid probably wearing slippers around the house or even socks, because patients are at more risk of falling with slippers than they are with good supportive shoes. The good news is most falls, I think, can be prevented. And by taking some simple measures, you may prevent a significant injury for yourself or for your loved one.